Okay, good morning everyone. Today we have a Dr. Shweta Walia from Indore. So we are talking about digital divide. In today's life, digital device has become an inseparable part of our life for our communication, entertainment, and education. It is very common to use our digital device. So we are want to know what are the basically digital device is and what's the impact of this.
All the digital devices they can be either a laptop or mobile or TV. All these come under the digital devices, and we all know that there is an increased use of these digital devices. Even we can't keep our phone away because every time the patient is calling us, someone we have to do some work. So we are all in continuous touch with these digital devices. Now, what do these digital devices do? Whenever we are using a digital device, we forget to blink. And because of decreased blinking, there is evaporation of the tear film, which leads to dry eye. And also, these digital devices, they have UV radiations, and these cause destabilize the ocular tear film. And because of tear film instability, there is increased inflammation of the eye, and this leads to a vicious circle leading to dry eye. So whenever you are using a digital device, there should be proper illumination. A safe distance has to be maintained from that. Proper posture has to be maintained, and we take care that we do intentional blinking. What is intentional blinking? You have to blink your eye, and both your lids should touch each other. Whenever both the lids touch, the new tear film comes and it regenerates the tear surface. And besides that, 20-20-20 rule needs to be followed. Every 20 minutes, you have to take your eyes off the screen and look at distance of 20 feet and for 20 seconds. So this has to be followed. And ideal thing is that you should not use in a stretch not more than 30 minutes. But if you are a computer user, then after every if you need to follow this 20-20 rule.
So, what are the common symptoms of dry eyes using after using a digital device?
So there is eye fatigue, there can be headache, there can be redness, watering from the eyes, which is because of reflex secretions due to dry eye. You can have grittiness in your eye, foreign body sensation. These are common symptoms of dry eye, which you get.
How can it impact on our life?
So whenever your eyes are red, so patient, everyone will like to keep it away from you, है ना. लाल आंख है तो सबको लगता है कि आंख आ गई है, आई फ्लू हो गया है, एंड patient will everyone will keep away from you. And if you have a continuous foreign body sensation in your eyes or a grittiness, so you'll be uncomfortable and your efficiency will decrease and you'll not be able to do your work properly.
Sometimes होता है कि अगर किसी आई पेशेंट का आई रेड होता है तो उनका मिथ बना रखा है
हाँ
कि उन्हें आईज आ रही
हाँ
है या
हाँ
कुछ आई
तो काला काला चश्मा लगाओ, है ना.
वरना फैल जाएगा
फैल जाएगा.
बहुत मिथ है ये.
हाँ.
जी. So, how much screen time per day is considered excessive in a term of eye health?
So anything more than 4 to 6 hours is considered excessive. And the IT workers, they work for 10 to 12 hours. Even if from when they're off from their work at their home, they'll be having some job to do. So they are at high risk for dry eye, and they must follow 20-20 rule.
बेसिकली पॉइंट ये होता है आजकल ऑलमोस्ट यंगस्टर हो गए या बड़े हो गए सभी ऑलमोस्ट सभी यूज करते हैं तो उनके लिए क्या करना चाहिए हमें अपनी आईज को टेक केयर करने के लिए टाइम नहीं मिलता उन्हें बैठना ही बैठना होगा स्क्रीन के आगे मे बी 9 आवर 10 आवर सो क्या हमें क्या क्या कर सकते हैं जो
सो प्रॉपर पॉस्चर मेंटेन करें, स्क्रीन की लाइट को मॉडरेट रखें, है ना. यू कैन यूज फिल्टर्स ऑन दैट विच आर यूवी प्रोटेक्टेड. They can wear anti-glare glasses or blue cut glasses which can save the eye from blue lights that are coming from the computer screens or the digital devices. They can put lubricating eye drops. The hydration should be maintained. If they are sitting in an AC room, the humidifiers can be put. These are common measures, and if the symptoms persist, they must meet the ophthalmologist.
So, what are the effective treatment to manage dry eyes caused by a digital screen exposure?
So I already told that if you do all these things, definitely dry eye symptoms will reduce. And if the symptoms persist, then definitely they must meet
Is
ophthalmologist.
there another point you want to share us?
Anything that is persisting for more than 2 to 3 days, ophthalmologist must be consulted, and over the counter drugs should be avoided.
Sometimes people don't understand, so they are using the phone continuously.
Continuously.
So, how can we manage them?
So screen se aankhein hatani hai. It is not very difficult if you are seeing a screen to go and look at the distance. So in between they need to take a break, look at distance, and do intentional complete blinking.
मे बी जैसे आजकल का टाइम ही हो गया है मे बी मेनली चिल्ड्रंस तो उनका ये है जब वो फोन चलाते हैं तभी वो खाना खाते हैं वरना वो
नहीं
खाना
खा-
नहीं खाते उन्हें एडिक्टेड होते हैं बहुत ज़्यादा
Correct, very correct.
तो उनकी आईज पे बहुत ज़्यादा इफेक्ट पड़ता है डिजिटल डिवाइस से तो उनके लिए क्या करना चाहिए क्योंकि पेरेंट्स भी बहुत कहीं ना कहीं परेशान होते हैं कि क्या करें बच्चा ला ही नहीं रहा
नहीं, एक्चुअल में बच्चों को नहीं मालूम होता है कि उनके लिए क्या करेक्ट है
जी
है ना.
जी
इट इज द पेरेंट्स ड्यूटी टू कीप देम अवे फ्रॉम द चाइल्डहुड. सबसे बच्चा जब होता है छोटा उसको नहीं मालूम है स्क्रीन क्या है, पेरेंट्स ही पकड़ाते हैं उसको स्क्रीन हाथ में. तो इट इज एक्चुअली समथिंग इज लैकिंग ऑन आवर पार्ट, पेरेंट्स पार्ट,
जी
that must be changed and incorporated in their lifestyle. And they should not, even if the child is not cooperating, a screen should not be given in the hands of children.
इसके अलावा अगर कोई इधर आप देना चाहो एडवाइस क्योंकि कहीं ना कहीं बहुत ज़्यादा एडिक्टेड है सभी चाहे वो मोबाइल हो गया या लैपटॉप हो गया टीवी हो गया ऑल दो जितने भी डिजिटल डिवाइस हो कि क्या करें किसका ज़्यादा यूज़ ना करें मतलब कुछ और अदर एडवाइस जो आप देना चाहो
यही है, अपने को ही लाइफस्टाइल मॉडिफाई करनी पड़ेगी अपनी.
थैंक यू सो मच मैम आपने इतनी अच्छी हमारे को पॉइंट बताए और इतना अवेयर करा इस टॉपिक के बारे में थैंक यू सो मच फॉर कमिंग
थैंक यू.
थैंक यू